Welcome, everybody, to the inaugural I4 Insights, a podcast where we highlight amazing organizations who embody our I4 spirit of innovation, inspiration, invigoration, and ideation. Welcome to I4 Insights, Andrew and Joy. Thank you for joining me, and I'm looking forward to our conversation today. I'd like to provide you both an opportunity. Introduce yourselves to the I4 community. Joy, I'm going to get you to go first.
Hi, I'm Joy Ardanaz. I'm from CGI in Ottawa, Canada. And I lead the health practice here, in charge of digital transformation in the health sector, and have a long background in healthcare, working with various EMRs, EHRs, as well as cardiac imaging, and have been thrilled to be a part of the CGI community for the last couple of years.
Awesome. Thank you, Joy, for that wonderful introduction. And Andrew, I'd like to throw it over to you.
Sure. Hi. Nice to meet you, Josh. I'm Andrew Donaher. I'm the Vice President of AI and Analytics for CGI Canada. So I run the national practice for AI, and I also run our Western Canada AI team out here on a day-to-day basis. So I'm the AI complement to Joy's healthcare experience, I guess, on the show. Thank you for having me.
Oh, that's awesome. And I'm so glad you both could join me today. You know, I'm going to throw you a softball this morning just to get us sort of started. I'd love for you to tell me a little bit about CGI. What's the work that you do and what's like the mission of your organization?
Sure. So CGI is actually a Canadian founded company. We are, amazingly enough, sometimes known as one of Canada's best kept secrets. We are a publicly traded company founded in 76 in Quebec City. We're now 95,000 people globally, 400 offices, 40 countries. We do obviously work with healthcare around the world, but we also we launch and manage the satellites for the European Space Agency. So 3 billion people a day get their weather because of us. Some of our software helps to power Interact. So when you're doing your banking, that's us. But we're a company that's dedicated to delivery. We're a company that's dedicated to helping organizations realize the value of their technology assets and their data assets so they can deliver value to their citizens and their stakeholders. That's really the core of what we do.
That's amazing. Thanks, Andrew, for that. I just have a quick question. You know, I was going through your website and some of your materials, and what I really found is you use some interesting language around health. And in particular, you know, you mentioned health tech versus tech that is in health. And I'm sort of curious, like what's the difference between technology in health and health tech as you describe it?
From my perspective, spending a lot of years in the healthcare environment, hospitals have a lot of technology. Some of it is mainstream technology, your Microsoft, your cloud, your business applications that drive the operations of hospitals and healthcare, things that are common to every operational business. We all share those same applications, and many of them are customized to, the business of doing healthcare. Then there are health tech that is specifically meant for the provision of healthcare. So you have biomedical applications, you have tools that are specifically designed for, diagnostic care, for, treatment of patients, for the delivery of care. And so those are very customized and highly specific tools that are specifically meant for doctors, for nurses, for hospitals. And so, these are very advanced tools, but we're getting into a world now where, Andrew certainly is understanding this more, where AI is bridging those, where we're starting to see, tools like Microsoft Azure or AWS, where we're taking, AI and developing applications that interpret the data taken from a diagnostic machine like an MRI, and developing predictive tools that can now be used in conjunction with something that's diagnostic and helping a doctor So where does that fall in with health tech? It's no longer, a Microsoft tool, but it's something that now is a diagnostic tool. And so it's actually, we're seeing this meld where, where does it fall on this continuum? But it's actually, we're in this brave new world of health tech, I think, where we're really, a whole new field is opening up, and it's really an exciting time.
That sounds really amazing, Joy. Thank you so much. Andrew, I wonder if you could add in a little bit around this utilization of artificial intelligence or AI. What do you mean when we're talking about using predictive models? And how does that look like for clinicians who are on the ground?
Yeah, so the world, as we know, the world of AI has changed in the last year or two. And I think the biggest difference is for clinicians. One of the challenges that we're seeing around the world, and I'll give you some examples of the predictive and even diagnostic capabilities with AI. But one of the key things that we're seeing is it's not possible for clinicians to be able to know everything about everything anymore, right? The plethora of information, the speed with which it's coming through. We're at CGI, one of the key things that we talk about is responsible AI. And by that, I mean, we're always using human in the loop. And we're using AI to make subject matter experts more efficient. So it's about helping clinicians to be able to diagnose more quickly, to understand more quickly, to use their expertise and take away the non-value hunting time, right? We're helping in the operational side of healthcare with the same sort of thing, whether it's predictive for supply chain operations for the hospitals for supplies, or whether it's, like you said, on the clinician side. One example, actually, I don't know if you've heard about it, but have you heard about what we did in Helsinki around cerebral hematomas and brain hemorrhaging? Have you heard that one?
I haven't heard that one. I'm excited to hear more, though.
So we partnered with Helsinki University and Plan Mecca, so the manufacturer of digital imaging. So this is a great example of healthcare tech versus meeting non-healthcare tech. And so what we did, so there's about, in Finland alone, I don't know if you know this, but this was a great stat that we learned. There's about 180,000 MRIs taken of brains every year.
Wow.
So people having, challenges, they have a hematoma, or they may have a hematoma and they're getting a CT scan or an MRI scan done at the hospital or even at the emergency clinic. And so what we did was we were able to take those, and in conjunction with the experts and the doctors in the hospitals and the university, is we're actually now able to use generative AI solutions to read the MRIs. And we can detect days and sometimes weeks in advance brain bleeds that aren't detectable by the human eye. So by having the AI solution complement the experts, we're now able to diagnose and to begin to treat those issues in advance, or treat those issues in advance of when we used to be able to treat them. So that's a great example of using healthcare tech and tech in healthcare to actually help people on a daily basis to make those experts more efficient. And you can extrapolate that use case out as far as you'd like. Those are the types of things that we're seeing every day. We're even starting to do something, and I'll just briefly discuss one more, but we're even starting now with using what we're calling digital triplets. So we've all heard maybe about digital twins, where we're able to take all the data coming off various systems, and we're able to create sort of a digital model of that entity, right? Well, now what we're able to do with generative AI, because of the advancements that have been made, we're now able to not just create that model. And previously, humans were the ones looking for anomalies or trying to create scenarios in order to test. Now, what we're able to do is have the generative AI solutions look at those digital twin models and be able to look for other interactions between data features and between different types of interactions and variables that we weren't necessarily thinking of before, or to be able to model additional different types. So now all of a sudden, the AI is not only helping us to create models of what we've got, but it's helping the experts to ask more and different questions to be able to try and diagnose things or make hospital operations more effective by leveraging those tools.
It sounds like you're doing a bunch of amazing work, but is there anything in particular that you'd like to highlight for the I4 audience? Something that maybe you're just really proud of?
I'd love to talk about what got me to CGI in the first place. I was working at a hospital here in Ottawa for many, many years. And during that time, I developed a lot of skills in cardiac imaging, in electronic medical records and clinical management workflows, a lot of things. And CGI contacted me out of the blue one day and said, we have a contract to develop a prototype of a medical clinic for the Canadian Space Agency. We're developing something that is for astronauts that could be used on the lunar surface. And I was mind blown. It was the design thinking of it. It was the innovation, the thought of how could this be changing the way we deliver healthcare, not just in space, but for humans here on Earth in isolated communities, for underserved communities. So part of the challenge was how could we make this work for example, remote Indigenous communities that don't have access to care on a regular basis. We were given the opportunity in under a year to do rapid prototyping, and that's what we did. Is that we over the course of 1 year, from conception to design to building to testing to delivery of this fully built prototype, we developed a smart container that had the ability to check in, guide the patient through this whole interactive experience of self-testing, telemedicine, medical education, treatment, and all sorts of activities. And it was just such an amazing experience. And I'm so proud to be part of CGI's delivery of this. But I'm also really excited to see where we take it next, because it's not the end of the journey. It's just the beginning.
Joy, thank you so much for sharing. It sounds really, really amazing. And I'm so keen to learn more. But I got to ask, Andrew, what about from yourself? Is there anything in particular that you're proud of from CGI?
I'm going to share two really quickly. So one was around, there's a consulting, IT consulting company with Cowichan First Nation called Mustamuk Information Solutions. They're building a system called the Indigenous Digital Health Ecosystem, IDHE. And so one of the challenges is that, in the First Nations communities across the country, an Indigenous person is 10.2 times more likely to die in a fire than a non-First Nations person. And an Inuit child is 13.6 times. And so we were trying to figure out how to use AI and how can we help to create, to get a risk analysis of various structures around nations across the country in remote locations in the same way. And so what we did was we actually built an application where you can walk in with your phone and you can take pictures of the structure, and we use AI computer vision to identify where are the fire extinguishers, where are the sprinklers, what are the other issues. And so then once it does that, it builds a 3D model of the structure of the facility, identifies all those determinants of health support assets for fire in the facility, gives you a risk score, and then all of a sudden you're able to see, okay, where do I have issues? How can we, address any issues? Where are we totally fine? We don't have to worry about anything. So that's one aspect of using it from a preventative side. Another one is actually here in BC cancer. Another quick example of that. So they were having an issue where the call center was getting perpetually inundated with, is there parking at the facility? Can I bring my spouse with me? How does that work? So a lot of these calls were coming through to the nurses that maybe weren't necessarily, they were more operationally related than healthcare related. Mm-hmm. And so we were able to create a virtual assistant on the site using applied AI that helped to answer all of those questions. So we actually got a 17% improvement with the nurses because they were able to focus on the healthcare answers. And so you can actually see their shoulders drop and relax when all of a sudden they're able to do more and support people. And it was also really interesting, and kudos to BC Cancer for this, because they had a lot of people saying, no, cancer is very personal. We don't want to, have a virtual agent interacting with people about that. But what we found was a lot of people prefer to use those virtual agents when they're accurate and when they're effective, because they're not ready to talk to somebody yet. They're just trying to get information.
So it really, really resonates with me as we sort of move into this sort of future space. But now I'm so curious from the both of you, These are great partnerships between public and the private sector. But I'm curious, what does this mean for Alberta? Like, what is the next steps, and how could we bring some of this work to start affecting maybe our rural communities or individuals who are looking to access their information in a more meaningful way to them?
Well, I think it's important for Alberta leadership to really put forth a policy of having a design thinking approach. Human-centric design has to be forefront in the way they approach these things. A systems-centric front door to government, to healthcare, has to be a part of the approach. We've had a very fragmented, siloed approach to healthcare for a very long time. And this has resulted in what we're experiencing in healthcare. And it was a result of the way that technology developed. I mean, we had this little piece came up and developed here, and we adopted it. And then this came up, and this was a new idea, and somebody else adopted it over here. And you saw these little things evolve over time. But we're much more mature now. And we have to start thinking, okay, how do we bring this all together in a way that makes sense? And start thinking of the path. Think of it as an angiogram. And I call it a data angiogram. Where are the blockages? Do you have a smooth flow? Do you have a smooth flow of information? And do you have a smooth flow of the experience? And if you don't, then it's the same as having a heart attack. It's the same as having a stroke for the patient. It's just as deadly to the experience. And we see this all the time, is that if your data isn't flowing, if patients are getting lost in the system, if patients are their records aren't making it from point A to point B, if they're not being informed of an appointment, if they're not getting a seamless experience through the healthcare system, it's very, very serious. And so we have to start taking this holistic approach to technology, to data. And I think Alberta, if they take this approach in their policy, if they take this approach in their contracting with an organization that has this innovative design thinking mandate with this approach, they will achieve this result.
Thanks, Joy. Andrew, I'm going to give you an opportunity to answer the same question. What's next?
I would say, kudos for the areas that we're looking to do, but now it's time to pour gas on it. Like, it's time to be bold, be brave, be courageous, and get after it with a bias to action. The advancements that we've had in the last, 2, 3, 4 years maybe in the space enables us to move forward. We do it with responsible AI. We do it with, human in the loop. But when you look at the demographic changes that are upon us, 2016 was the first time in the history of Canada where there were more people over the age of 65 than under the age of 14. Right? We all know what this demographic tsunami that's in front of us. We're not going to have more people to be able to address these issues. We're not, the healthcare onslaught that's upon us, and the only way we can deal with it is by adopting these technologies in a responsible way, by making sure we get to production, making sure that we're investing in not just the data designs, but the actual people to move the data. Like, I can't emphasize that enough with what I've seen in healthcare in not just Alberta, but BC and around the world, Helsinki, wherever. Our ability now has changed, and we must move forward with a bias to action. I can't emphasize that enough. So as we're looking at design thinking to look through things, yes, but we need a bias for action, and we need to move.
Andrew and Joy, it's been an absolute pleasure talking with you both today. Thank you so much for that wonderful conversation. If our individuals from I4 would like to learn more, what is the space for them? Where do they need to go to find out more about the amazing work that you're doing?
Yeah, thank you for that, Josh. It's been a great conversation today, but I would encourage everybody, reach out to cgi.com, reach out to your local offices, reach out to our national group. We're here to support organizations like Alberta Health.
Amazing. Thank you so much. To our listeners, Thank you for taking part and listening to our conversation today. You both for being here. And thank you for being part of the inaugural I4 Insights podcast.